My name is Dr. Ahmed Abulhana, and I am the course director for the MPharm program at Ulster University. I'm also joined by a number of my colleagues here. So I got Mr. Martin Smith, our university admission manager. I also got Dr. Deborah Lurie, the deputy head of the school and the director for education. Also, I got Dr. Heather Coleman, the academic admission tutor, and Dr. Aaron Courtney, the school lead for the research and our former course director, and Mrs. Avril Fox, the school officer. So thank you so much for your for joining us today. And tonight you will hear from me briefly about the course, but with more focus on the interactive component that you will complete if you are interested to join our MPharm program. So what is it? We will cover actually what is it and how it works and how to feel confident going into it. At the end, we will leave some time for questions as well. This is our lovely Korean campus, as you can see. So we are delighted to be in the greeny white campus. And as you can see here, this is where our School of Pharmacy and Pharmaceutical Sciences is. It's a modern teaching facility, including our model pharmacy, our clinical education suite, and also it is an incredible location on the North Coast. So if you are interested in water sports, walking, etc., you will love it so much because we are just close to the lovely Portrush and Port Stewart. Both are just nearby, and this actually makes this campus a fantastic opportunity for serious study, but also for quality of life. So it's very much study and life balance. As you can see here, we are incredibly proud to be consistently among the top schools of the pharmacy in the UK. As you can see here, we, over the last decade, whenever you are looking at our ranking, we are very proud of being always on the top list. Also, the University of Ulster has been awarded recently the University of the Year in the UK and Ireland, this for 2024. And we believe that the standard is driven by our outstanding staff, our excellent facilities, and indeed our exceptional student community. And as you can see here, one of our graduates who have given us the consent to actually put his quotes into the presentation. And as you can see, simply, he put that exceptional teaching plus hands-on practice made the difference to her career. That is the experience that we aim for all our students. Real skills, real confidence, and great support. So as you can, I can read his quotation here. So the single best decision I made as a 17-year-old was to select pharmacy at the University of Ulster on my UCAS application. On reflection, the course was delivered with exceptional standards of teaching and hands-on practice experience that provided myself with invaluable skills and qualities I have used every day to build my career as a pharmacist. We are really, really proud of our students and graduates, and we work continuously to improve the delivered experience. What we are going to cover today, this is a plan. So briefly, some information about the course and with more focus on the interactive component. So that's the plan for tonight. If you are interested in our MPharm at Ulster, these are the details. So the UCAS course code is B230 and the university code is U20. And also you can see on the slide that the course web page, this actually web page, it includes everything that you need, including entry criteria, modules, assessments, placements, and much more. So please have a read through it. And if you still have questions, please don't hesitate to get in touch after tonight, after we cover this. If you still have any questions, the course team and the admission team at the university will be more than happy to answer your query or question. Meanwhile, while I'm presenting, folks, please put your question into the chat box, and we will pick up them at the end to answer them as best as we can. As you can see, because in Ulster University, our courses are continually reviewed to reflect the new science practice and also the feedback of our students. So what you can see about the course, about the modules, etc., please refer always to the web page, because if you would like to have the latest list of the modules, the course, etc., please contact directly the course team in case if there's any updates. But all of the details about the courses, the modules, assessments, and everything are available already on the university web page. Also, at Ulster, you will get an innovative way of teaching. So we believe in personalized teaching. So there are a wide range of teaching styles that you will have if you selected Ulster, if you are interested to come to Ulster, in particular to our MPharm course. So at Ulster, you will get personalized teaching, one-to-one mentoring, small seminars, career sessions, top class facilities. And we are so proud of our model pharmacy facilities that we have at the School of Pharmacy, our clinical educational suite that we simulate everything that the student pharmacist would have before goes to the real practice and to the experiential learning. So we integrate also the 12 weeks, up to 12 weeks of experiential learning across the program, which covers the 3 sectors that the pharmacist might work in, including GP practices, hospitals, and community pharmacies. So, as you know, pharmacists today are increasingly patient-facing clinicians across community, hospitals, and primary care settings. Our program is designed to build the clinical reasoning, communication, and safe decision-making that you will need to thrive in those settings. If you look previously, over the past decade, the role of the pharmacist has changed dramatically. So as you might know, or if we have some parents that joining us, traditionally the pharmacists were seen mainly as scientists and experts in medicines, focusing on accuracy, quality, and safe supply of the medicines. But today, pharmacists are increasingly recognized as clinicians in their own right. And that's why the profession has moved towards much more patient-facing clinical role, particularly the development of the pharmacist independent prescriber rule, which is integrated in our curriculum and our course, actually. So, and for such reason, because pharmacists now are, prescribing medicine, assessing situations, and they can take an independent clinical decisions. And because of that patient-facing approach, the communication, the effective communication, and critical thinking, logical thinking, and ethical consideration are a big part of the pharmacist role at the moment. And that's why it is very much integrated with the requirements of the regulators about the interactive component. This is here a summary of our design, our curriculum. As you can see from year 1, the students will be in our clinical education suite, our model pharmacy facilities, starting simulating things. This includes the physical examination, some basic prescribing skills. Then across years 2 to 4, the students will put their skills into practice, because we have an innovative structured experiential learning across post-primary and secondary care. This includes up to 12 weeks of experiential learning in GP practices, hospitals, and community. The idea is progressive confidence, learn it, do it, reflect, and then do it again and do it better. So we are giving students actually the confidence of simulating and trying things before they go out to the experiential learning and then after to the foundation training. Our curriculum also is designed carefully in an innovative way that meets the regulator's standards, but also consider that students are different and they might have different needs, different preferences, and different learning styles. It is an integrated curriculum where we integrate both science and practice together in all modules in a spiral way. So we revisit topics again over years with more competency, more skills, and indeed more complexity. For all I have mentioned, including that independent prescribing skills, the patient-facing approach, the regulators require every MPharm program to include an interactive admission component. This is to assess the applicant's values and professional suitability, because again, big part of the pharmacist's role now is to interact with the patients and other healthcare providers. So we have designed an interactive component that is short, friendly, and highly structured. This interactive component is designed to stimulate discussions with the candidates and to provide an opportunity for prospective candidates to demonstrate their own values and professional suitability. So the candidate, our candidates or prospect applications will be asked a series of questions specifically designed to stimulate discussion with the staff members. So again, it is there are some situational scenarios, and the reason is to stimulate that discussion. We need to see the students' effective communication, the logical thinking, critical thinking, the reasoning of the answer, the rationale of his or her answer. So that's why normally there is no right and wrong answer. It is the way you communicate it and the way you rationalize your answer. So the interactive component usually have two parts. 15 up to 15 minutes actually of conversation or dialogue with a staff member, and 15 minutes of a simple calculation test. So the first part of the interactive component, which is the situational scenarios and the conversation with a trained staff member, focuses on the student's capacity to work logically and ethically with the information provided. So we want to see that the students actually make effort to provide the reason and the logic for their ethical decision making. The interview does not actually assess any science or pharmacy related topics and does not require any prior information or knowledge about the science subjects, etc. It is very much situation scenarios, and we would like to see students' capacity in effective communication, logical, and critical thinking. So again, there is no right or wrong in the answer. It is the way you communicate it and the way you rationalize your answer. This is here, as you can see, an indicative timeline. So as you can see, the applications for please apply if you are interested in the course. Please apply before 14th of January 2026. And following the application, the admission, our colleagues actually in the admission team will provide the conditional offers, and then this will be followed by an additional information regarding the interactive component. This will be sent out as soon as possible by our fantastic admission team. And in terms of the interactive component, the first interactive component will take place in our campus at Korean on the 7th of February 2026. This is the first interactive component. Others on campus will be scheduled later. But also there will be, the first one will be on campus in person, and then other in person will be actually scheduled later. However, there will also be online sessions for those who might not be able to come to Korean campus or for our international applicants. Then by the summer 2026, offer holders, after successful completion of the interactive components, will, and other checks like Access NI, etc., they will have to make their choice and make their firm and insurance choices. And then those who are interested after 14th of January 2026 will need to submit their details, and our admission team actually put them into the waiting list, and if places become available after all results are known, they will be offered the guidance and the information regarding completion of the interactive component, etc. We have today our Mr. Martin, our manager of the admission team. So we will be happy to support you with any question regarding this, but please keep in your diary that actually 7th of February is our first confirmed interactive component in campus. Now I'm going to more details about the interactive component. So as you can see, what is the interactive component? It's an approximately 30 minutes time. So it consists of two parts, 15 minutes for the interview itself and 15 minutes for the calculations. It could be face-to-face on campus. However, online sessions for students that are not able to attend will be scheduled. The interactive part of it is actually about situational based judgment questions. Again, we don't require any prior information or pharmacy related, but it's more about how you interact, how you effectively communicate, and how you rationalize your response. The second part is about numeracy and calculation, and it's approximately 15 minutes. It takes up to 15 minutes actually. And this calculation is like a basic calculations that is needed for any pharmacist actually to like basic foundation calculation like GCSE type calculations that is required because part of the pharmacist role is to make sure an accurate and correct dose provided to the patient, etc. And we need this across the MPharm modules. So again, it's very basic, simple calculation test. It comprises about 5 questions, and I will give example in the next few slides. So what we are looking for actually that will be assessed during the interview is the 6 key professional values and attributes. As you can see them, person-centered approach, problem solving and decision making, self-motivated learning, effective communication, professionalism and integrity, as well as resilience and adaptability. So again, each question or scenario, usually it's about 4 scenarios in within 15 minutes. And these scenarios, each scenario will cover some, does not have to cover all of these 6 professional values, will cover some of these values. And again, what we are looking for actually is how the student is communicating, how he is or she is having an effective communication, how they can logically and ethically propose their response in an effective way and rationalize their answers. So again, there is no right, there is no wrong. It's how you respond to the scenario or the question asked. It's actually both ways. So it's a conversation both ways. The staff, our trained staff, will stimulate the discussion with the candidate just to check the communication style, to check the logical, critical, and ethical thinking. Those who are interested and those who will be offered the interactive component interview, they will be briefed about this in the day as well. So we will remind the candidates about these 6 professional values before the start of the interview. So the flow of the interview, how it works. So staff will assess the candidate performance based on what they say. And each scenario is scored by a trained, experienced staff, and candidates will be ranked on their total score. And staff will highlight if they have any concern about anything that the students might say. So it's again, the three main things of those professionals are the communication styles, the effective communication style, the ethical consideration of the situation, and also the critical thinking and rationalizing of the response. So in terms of, just to give you a head of example of it. So usually we introduce the assessor, the staff introduce themselves to the students and then confirm the applicant's name, email, etc., and provide 4 scenarios. But this will be provided on timely manner, like one by one. And the first one is usually to stimulate the discussion between the students and the staff member. And it's the big focus is about the communication style. If there's any significant concern raised, like a red flag of one of the answers or so, something like the student did not consider any ethical consideration in the scenario or the situation, it's a situational scenarios. So we need that logical, ethical response in an effective communication way. Let's say if somebody has been flagged because the staff member has said there is a concern regarding one of the answers, did not consider the ethics, or was just like a complete unexpected answer that does not consider the situation. And I will give some examples at the end. A red flag will be raised. This will trigger that supportive follow-up interview with a senior staff member is required. So it is an extra opportunity to demonstrate the values and suitability and making sure that this concern is genuine. So again, I would recommend and suggest that any of you actually just feel relaxed, comfortable, and respond to each of the scenario in a normal way, in a relaxed way. You don't have actually to be worried about whether my answer is correct or wrong, because there is no right or wrong. It's the communication. It is the logical sequence and thinking. It's the critical analysis. It is the ethical consideration. That's what we are looking at. So again, just as a recap, for those who are interested to apply to our MPharm and are asking about the interactive component, simply you think through the information, give the answer, explain your logic clearly, and as you can see here, you will give some time. So whenever we deliver you with the scenario, you will be given some time. Think about the information that you are given, and provide the answer to the problem, and most importantly, in an effective way and in a logical thinking, and be ready to justify, to rationalize your answer. We focus on how you communicate, how you rationalize your answer, and again, no prior information is required. I can give you an example of one of the scenarios that we might ask. Simple things like, okay, you're working in a pharmacy and one of the patients just turned up asking about his medicine, and he was a little bit angry, and he's not happy about one of the medicine that was prescribed for him or for her. How do you proceed? Something like this. So it's very, what we're looking at actually is, first you listen to the patient, and then second you maybe take the patient to the like a private consultation room, and then identify why they are not happy about their medicine, and then you identify the issue, try to provide the support. If you need to get more information from his GP or her GP, if you would like to get some support from a colleague, etc. So it is something like this. Again, it's a situational scenario. This is one of similar scenarios that we might bring to the interactive component. I'm just giving you an example so you know how and what is about this interactive component. In terms of the calculation, As you can see, you will be given a series of calculations to complete. This up to 15 minutes. This takes up to 15 minutes. Calculator will be permitted. Pen and pencil and paper are permitted as well. Again, we don't require knowledge of complex mathematics. We require foundation basic calculations. So there will be 5 questions, up to 5 questions of calculations. Some of them are very, very simple. And again, it's a GCSE type calculations. So it's a very simple. It does not require complex mathematics. So if you didn't get any further math in the GCSE, don't worry, it's a basic math. So for example, we can ask, one of the question might ask about like a patient is taking certain doses, like 20 mils of a medicine 3 times daily for 14 days. You know, for example, what is the total volume of it? Something like this. But also it includes other, little bit advanced calculations, more than the example that I just provided, because the 5 calculation questions are integrated and increasing in complexity in a way that making sure that you have a good foundation mathematics that will be helping you when we deliver the modules across the MPharm course. And remember, because the regulators, the registration exam will have 2 parts. One of the parts will be calculation. During our MPharm course, there is an intensive calculation elements that we will actually provide the students over 4 years. However, we still require a basic foundation calculation skills. And this is the second part of the interactive component. So again, these are the 6 professional values that we are interested in across the overall interactive component, and including the calculation test. Things which are expected in the calculation, as I've mentioned, numbers of the tablets over a dosing schedule, simple things like the total volume for a liquid, simple percentage of yield from like a chemical reactions, etc. So it's very basic foundation. So if you got a GCSE math, that would be fine. There's no worries about that at all. So this is actually my last slide. Sorry, I've been so long today. So all current admission details are now live on our website. And if you have any questions that might pop up after tonight, please email us. We will be very happy to answer your query. We will be very happy to support you. And also, we will start now taking some questions and try to address them as best as we can. Before we jump to the question, this is our UCAS code again. B230. This is the MPharm, our UCAS for MPharm course, and the Ulster University code is U20. If you are interested in our MPharm, please apply. Thank you so much. So I think now we are gonna pick up questions from the chat box. I'm pleased to have my colleagues here actually responding to, so we got Mr. Martin Smith here actually provided some answers as well. So, and Mrs. Fox, Dr. Courtney, Dr. Laurie, all of colleagues actually, thank you so much for helping the chat box today. So I would probably now stop the recording and then take questions if we have.